If you want to know how I competed in a CrossFit competition despite an acute calf injury, you need to tune into this episode. Hi, everyone. Welcome back to the podcast. Welcome all new listeners, and welcome back to those who have heard my content in the past. If you want to know how I competed in a CrossFit competition despite an acute calf injury, you need to tune into this episode. Before I go on to the episode, what is better in life? We have some reorganization happening in our house. My wife and I like to move things around every few months, purely just to change it up. It's more so my wife, Stephanie. Um, so we're going through some just moving a lot of pieces of the house around. So that's been good. My kids are doing great. Zach is in flag football, and he is getting some touchdowns, which is great, just to boost his confidence. The more I see my kids grow, the more I see other people's kids grow. I understand that sometimes you can't really push kids; they just kind of naturally evolve when they're ready. And I think you push them hard, it kind of pushes them away. So I'm starting to see that with Zach. He's starting to like blossom in sports. So it's been great to see that. Daughter Alex is as fiery as can be. And I'm excited to share this story because there's a lot of takeaways that I have for clinicians. And I understand patients and athletes so much better just with my story alone. So, all right, let's go on to this podcast. All right, what is this about? All right. Um, I had a CrossFit competition. This is my first competition I've ever done before, and any of you who've been listening to my podcast before, I enjoy functional fitness. I enjoy weightlifting. I enjoy barbell movements, and I do train at a CrossFit gym, CrossFit Chula Vista. And someone asked if I would be willing to do it. I said, let's go. I'm not going to say no to a competition. However, everything was going great. Everything was fantastic, and some things changed a few days before the event. And I'll tell you my rationale and why I think it happened. And looking at my training leading up to it, what exactly happened and then what happened days before and then what actually happened in the competition, because I think there's a lot of things that we as clinicians, you're always trying to figure out why do things happen, right? If you're talking about atraumatic injuries, the only reason that people develop pain in a musculoskeletal framework is excessive stress or excessive load, or load over time. There is a predictable stress that changes the stimuli to produce pain. And I had to dig deep and figure out what happened. So let me give you some context. So I signed up for this event about a month prior. And leading up to it, I was training about 5 or 6 days a week. I'd say 2 days of high intensity, 3 days of moderate. I would say that, and then one full day off, and then one day of more of an active rest, bike, rower, just monostructural, just easy, just work over time. And everything was going great. And we all battle little things. My right quad was like starting to tighten up a little bit, and my back was a little sore. All the normal stuff. My left elbow, nothing crazy, right? And then on Monday, right before the event, they released the workouts, I think Friday, Saturday, or whatever it was. And so I was like, okay, they're pretty fair workouts. I had like bar muscle ups, box skid overs, some bike lunges. I mean, nothing too crazy within the functional fitness world. And I was like, that's fine. And literally that morning, it was a partner workout. So Christian was a partner for the workout, and he said, "Hey, what do you want to do this week leading up to the event?" And what's funny is I've helped athletes, thousands of athletes, get ready for like big competitions, big world championships, Olympics, Paralympics, you name it. I've done it, and I've enjoyed every minute of it. Well, what's interesting is he sent me that text, and I was like, "Whoa, my brain just changed. I'm not the provider. It was like, what just happened? Like I just had to switch it off. And I had to go back into PT where I was like, wait a minute, it's not about me. Hold on. What would I do normally leading up to an event? And so this is like a taper week. I said, hey, let's drop the intensity a little bit and control your volume, just get some work in. And so we did a light workout, and it was jump rope, some double unders. If you don't know what there are, two jump ropes in one jump. And I did that, and I felt something in my calf, and I just did a couple more, and it did not feel good. And actually, it was in the soleus, so it was on the inner part of my tibia, and I was like, oh no. So I went home and I was like, okay, this is not that bad. And I started walking and I couldn't dorsiflex. Like it's a grade one. I think after everything I learned, it was a grade one soleus strain with a little bit of my medial calf. And I'm like, wait a minute. Why? What changed in the last month? My volume didn't increase. My intensity didn't increase. I'm actually tapering this week. Why did this happen? So I'll tell you the things leading up into it. So my training was all consistent. But for those of you who know, the only thing that really changed, my diet was the same and my sleep was the same. The only thing that changed, I think, in hindsight, is that the weekend before that Monday workout, so 1 week exactly from the competition, I held the management of the barbell athlete CEU course. And I didn't do anything too intense. I didn't do any weightlifting, but I did do demo, and I did stand for over 16 hours in 2 days. And when you say it like, wait, that's not that big of a deal, but my volume of standing is very low relative to 16 hours. I don't really stand 16 hours a day, literally in front of people talking all day, every day. Like most of us, we sit, we stand, we sit, we stand. This was a long day of standing. And the only thing I can look at, if I look at my training log, that would be the only thing that actually changed. I stood for 16 hours. And a fun fact about me when I host CEU courses, if you've been to any of my CEU courses, I don't really eat during those days. I'm on fire. Like I love teaching, and you stop me for a conversation, I'll miss all my lunch. I really don't care. I'm here to like have a great time. I'm here to change the world. I'm here to help you get better. And so I'm all about working through my lunch. I'm working through all break times. I don't care. I'll just talk. I just want to hang out. And I didn't really eat, and I stood over 16 hours. And I think that if anything, that depleted, that added stressors to my overall training. And so when I came in on Monday, that gap between an increase in stress and resuming training was too large. And for some of you who don't know, you can kind of consider it in the acute to chronic workload ratio. This is something I covered at the management of the barbell athlete course. I might actually do a whole podcast on it because I think it's actually very helpful. And I just went over it with my team. But this concept says that the ratio of work from week to week to week can only go up 10% safely or down 20%. So say, for instance, you go out and you're a marathoner, or so you're a runner, and you run 10 miles 1 week, and the following week, if you only go up by 10%, that's only one more mile a week. So then that's 11 miles the next week, or 12 miles the following. However, when you make big jumps, 1.5 or 50% increase is really where you're going to have a significant potential for stress or an injury. So say, for instance, you're a runner and you went from 10 miles a week to 15 miles a week, that's a 50% jump. Based on the acute to chronic workload ratio, 50% is a big jump, and that's a significant risk for injury. And so the alternative side of that is that a 20% drop in stress, meaning you can't be completely deconditioned. You still have to train and do things. But I think I stood so long and I didn't eat, so I didn't replenish. So there was a larger gap in my decline, or my rest week, my deload week. So after processing this, like ad nauseum, multiple conversations, it's the only thing I can think of. I warmed up great that day, whatever it is. So I have the injury, right? So now what do I do? And so I'm 5 days out. So Monday's the day it got hurt. Tuesday, Wednesday, Thursday, Friday, Saturday, the 6 days I compete. Now, most people would say, okay, if you have a grade one soleus and calf strain and you want to participate in an event, is it possible? And the event had double unders. I think it was like 200 double unders, box jumps or box get overs, different variations, overhead squats, different things that did require the calf. And I then had to decide, what am I going to do? So I text my training partner. I said, "Hey, can you, or if you want to train, I'm in." I volunteered. I said, "Hey, if you're interested, I can find somebody else to get my place. I'm probably not going to be 100%. If you know me and my progressions, here's how I forecasted this from the beginning. If you're at day 0 injury, my goal was to be 100% with ADLs before I started training in an ideal world. Ready? So day 1 would be 25% ADLs, walking, ambulating with antalgic gait. Day 2 would be Wednesday. That would be 50% ADLs, 75% on Thursday, and 90% to 100% ADLs on Friday, which would allow me to train on Saturday. But now I'm going from 100% ADL, but 0% training up to 100%. If you ask, how do you approach managing athletes? I always will go, I will 99.9% go more conservative on the front end and then just have them risk it at the end. Here's why. If you injure them in that critical time point where you need to be conservative, especially those 72 hours, you then mess up their full potential. However, if you allow them to have some recovery, don't irritate it, and allow them, just leave it to the very end, it gives them an opportunity. And so I took that approach. So during this time, I was like, okay, I can't just rely on like rest and all that sort of stuff. So I just did some general blood flow. The first 48 to 72 hours, I did minimal tissue work to it. I applied a compression sleeve and I put heel lifts in. So the compression sleeve I bought a little bit smaller than normal size, just so I can have that full compression. Because if you think about it, those all that tissue is being separated now with the strain. So I wanted a compression sleeve to really push it together. And I bought a, but don't laugh at me. I bought almost like a 3-inch heel lift. So much my heel was almost coming out of my shoe. And what that did, where it shortened my tissue on the soleus and the calf. So it's less stress being applied across the day. How long did I wear that for? All waking hours. Now, there was a day where I didn't have it because I had to order it. It's not something you like normally have in your pocket. Now I'll have it. So I applied that. And I then took it easy. So for the first 42, 72 hours, compression with no stretch, no strain, no stress to it, with heel lifts. And people think I'm crazy, and my wife got a little mad at me. I wore tennis shoes to sleep. And the reason I did that is because if you get up in the middle of the night to go to a restroom or get a glass of water, or whatever it is, you then risk, if you're barefoot, you're going to have dorsiflexion and stress across the soleus or calf. So I wore the 3-inch heel lifts. I wore the shoes to bed, and I did that for 48 to 72 hours. And I wore that all waking hours. And what that did is allowed it to just heal and not irritate it. Did I do any meds? No, I didn't. I wanted to know what that tissue felt like, so I knew the sensitivity to be able to push and pull. I'm not a pro or anti-inflammatory person. I just wanted to know what it felt like. I tried to get in treatment, and there was not enough same-day cancels on the time slots that I wanted, so I didn't get enough treatment. But I would highly recommend that. In hindsight, I would have done that. I would have done like a flush. I wouldn't done anything aggressive. In California, we don't have dry needling, so I can't have that. My acupuncturist was unavailable. So it was like, all right, well, I have 6 days. What am I going to do? So you have to manage conservatively. So my wife was really, really helpful in this, in that with managing the kids. I couldn't like run after them. I couldn't really like walk my son to school. I couldn't like get out of the car and walk him into class. Like I couldn't do those things. So in the end, it was helpful to have Stephanie support with that. So in the first 72 hours, I really didn't have a lot of stress, which felt great. That's why Thursday literally was 75% with ADLs, but 0% with sport or with activity. On day 5, I said, okay, you know what? Let's do this. So I committed to it. I said, hey, I'm in. We're going to do this. So on Saturday, I tape it up with compression sleeve. I put my lifters on. Yes, I wore my Olympic weightlifting shoes with a 3-inch heel lift. That put my heel up so high, I felt like I was in high heels. and the compression sleeve. So I did overhead squats. We were doing bar muscle ups, pull-ups, lunges, sled push. Sled push was the interesting one. So there's a lot of lessons learned. Let me tell you this. So that was the timeline. Let me tell you a couple lessons I took off of this. Bracing is absolutely mandatory when you have a case like this. I think that PTs, we steer away from it because like research doesn't support it. Sometimes it does, and it could be on your CI or your mentor or your clinical instructor or your boss, your philosophy within your like clinic. I don't care. What you normally see is injured people 4 weeks after injury to around 12 weeks of chronic pain. Because of logistical challenges, a lot of us don't see acute injuries. More so, they're going to go to their primary care, or they're going to go to urgent care, or whatever it is. And when you have an acute injury, this is a whole different ballgame. I think it's very, very challenging to apply outpatient for post 4 week timeline and treatment into acute injury management. So 100% bracing is absolutely mandatory. Now you're going to wean away from that. I totally get it, but don't block it. If this was you, you would 100% wear a brace because you knew the timeline. And the reality is we know the tricks to be able to offset or unload tissue. And that was a huge takeaway that one, I would have done it for an athlete, but number two, I did it. I was like, whoa, big difference. Um, the heel lift is, if you can get those right away, I insert those right away, no shoes, or sorry, in shoes, all waking hours. They got to be in it. That way they don't add stress. Um, if you don't, the contralateral quad will be on fire. My right quad was burning because I didn't want to flex my knee. So all the weight went onto my contralateral quad and just eccentrically loading all day. It was like deep burn. So I think you need that support. Number three, don't irritate it. I think that most people, we work on like how to, work on the tissue and all these other things. Honestly, I would just not irritate it. Yeah, you can do a flush, but don't irritate the tissue. Super light contact. Your job as a physical therapist during acute injury in a time like this is give them a roadmap and don't let them mess it up. That's really what your job is. So if I would have come in to see somebody every day, all I would have been looking for as a patient or athlete, what am I doing for the next 24 hours? What do you need from me? What's the next step? And what that allows me to do is just focus on the short-term things so that way I don't mess it up. Most of the time people are looking for the tricks to decrease pain and fix things. Ultimately, it's not about that. It's about not messing it up so their percentages continue to increase while they're healing. And I think as physical therapists, we're trying to change those percentages. And this point, it was just let it ride. Don't irritate it. Next, I would have appreciated some manual work. That would have been great. Yes, I did it to myself, but there's something about having like relaxation and not having your nervous system on that would have been great. Save it till the end. If you're going to have an athlete compete and they're an acute injury, like you're a very short timeline, I would go very, very conservative for sure in those 72 hours. And if you have those first 2 weeks, be conservative. If you don't, you're going to try and maximize the conservative part early on. Do not irritate it. Do not be aggressive. Don't be a superhero, and allow them to ride it all the way to the edge and then allow them to play a little bit later. That way they actually have a chance versus you flaring them up from the beginning and saying, well, it wasn't possible anyways. False. I think if I would have gotten to a bike, if I would have done calf raises, if I would have irritated in the first 42, 72 hours, I would have ruined all my chances. It would have got me even worse in the hole. So consider that when you're working with these individuals. It is possible. If you would have asked me on Monday, are you going to be able to compete? I would have said likelihood 10%. And I would have said no, not possible. Like very low chance. And I'm glad I went through with it. There's a lot of lessons on this. Even my team was like, "What are you doing?" All my team of PTs, we had a coaching call right before the event and explained the situation. They're like, "That doesn't even make sense on paper. It doesn't, it's like not possible." Well, it is, but it just It's not, it's a risk because you have, even if you look at acute to chronic workload ratio, 1.5, I'm going from 0 to 100%. I'm going 200. I'm going 2.0 on this. So it becomes very risky. So with that, it is possible. I think what you as a clinician, what that allows you to do is communicate better and saying, do you really want this? I'll help you, but you have to know the risks. You have to know the possibility that you can make this worse. And if they're okay with that, I don't understand why don't we allow that patient or athlete to accomplish their goal. So it is possible, and I think you have to over communicate what you can and can't do and align that with their how aggressive or conservative they want to be, and I'll just give them a chance. So, but it is possible. And our role in this acute injury timelines is just frequent check-ins to make sure they're on the right path. Now, my concerns and my fear were real. I was like, I could really mess this up. I could put myself in a hole for a month. I can have a big strain. Um, and I didn't do it because of pride or anything else. I knew that I really wanted to do this. And there's an interesting story that I'll tell you that really um, stood out in my mind. In 2012, during the London Olympics, we had an athlete. I won't mention too much about this, but we had an athlete who was highly ranked within their specific sport within track and field. And I remember them asking me, saying, Chris, the night before the event, they got chills and they started coming down with the flu night before their final event, meaning they're in the Olympics the night before the event, and they start getting ill. And one option was to pull from the event. And you get people who work their whole life for something. It's 4 years. Now, my CrossFit competition is a little different, right? Like this is just a weekend course or a weekend event. It's community. It's nothing big. However, people work towards something, right? And you're excited and they're passionate about it. And this individual, the night before, developed the flu. The next day, felt horrible, 101 fever, just not able to, really do much, couldn't hold anything down, wasn't able to eat, and they competed later in the evening. So now it's even worse because they 12, 13 hours we have to be awake with not a lot of food, and they can only take in liquids. They're not feeling great, whatever it may be. That day, we had a conversation. They said, what should I do? I said, you've worked tail off for this. I think you all out. Full send. Let's go. And they did an incredible job. They got a third. They got a bronze medal with the flu in the final event. And I remember that story. I was like, you can back out or you can just try it and see how it goes. And I went with that approach, and I'm very, very happy with that. But I understand how it can go both ways. But as a clinician, it changes the mindset on how aggressive you want to be on that acute to chronic workload ratio. Do you want to give people that opportunity? Do you want to give it to them? As long as you've outlined everything, I don't see what's wrong. I think if they're responsible, they're an adult, and if they're a youth athlete, then you communicate that to the parents. So yeah, I really think that that's very critical for everyone to truly understand. And we did come away. We did win the event, and it was fantastic. It was an amazing event to be part of. And I think most importantly, like you asked why, I just wanted to be part of the community event. I wanted to hang out with my friends. I wanted to hang out with community, and that meant a lot to me. So even if I pulled out maybe one like event in, it didn't matter. I got to hang out with everybody and be part of something. And I think that's all people want when they're competing or when they're doing something. For some people, it means like it's their job, and others, it's like just to participate in the community. So you have to see where it is. Don't get your brain too fixed into the research and, like, is it really gonna, is it, they're really gonna be pain free? Some people just want to they want to have enough pain to be able to participate. That's all they want. Like it's just enough, I can get to it. And so for me, it was a great time. And the hardest part about the event was recognizing that I was masking a little bit of that soft tissue inflammation because I had so much compression on this thing. And I had lifters. So I developed blisters on my feet from wearing lifters all day. I wouldn't recommend that. And so a lot of lessons learned, and I had a blast. Would I do it again? Oof, every timeline's going to be different. But the exciting thing is if somebody comes to me, a patient athlete, and asks, or if you're a physical therapist and you guys are like, hey, Chris, I just have a hamstring strain. I'm 11 weeks out or 6 weeks out from an event and I have to do, like, I will do that math. It's just whiteboard sessions. It's just a straight map. Does this make sense on paper? And then it's how aggressive do you want to be at the tail end? When people come to me after managing crazy cases with short timelines, I'm like, things are possible. It's just how much do you want to push and pull, and do they have enough information, education, and a roadmap to be able to sit like week by week, day by day to get there safely. You ever have a challenging case, send it to me, Dr. Chris at drchrisgarcia.com. I'll do a full whiteboard. I'll do a whole podcast on it because I love this stuff. Is it possible for somebody with a ankle sprain 2 weeks to go into a high school elite soccer match? Yeah, absolutely. I've managed that. I've done it. Is it possible with a grade 3 ATFL sprain to return? That's debatable. There's a lot of things that I've seen. We've had MMA athletes who competed under crazy circumstances, shoulder subluxations, ankle sprains, acute back injuries, neck pain. I mean, just a lot of stuff that adds stress that you would say under normal circumstances, this is not possible. And truly, this is what sports physical therapy is about, is helping people like stay active despite all the chaos that's happening to them. And so when I think of sports physical therapy, I'm thinking about the full spectrum. I'm not thinking about like the fancy exercise you see on Instagram. I'm thinking about, can this person manage an athlete at any given time, postseason, preseason, in season, off season, all year long? And if they're injured in any part of that, how do you manage that differently? Can you manage a strength cycle, getting them to the general preparation phase right before preseason? Can you manage an injury in off season? Yeah. Can you manage an injury preseason? Yeah. Can you manage an injury in season, preseason with a short timeline? That's where it becomes very, very tough. And so there's different parameters that I use. And you as a clinician have to understand, okay, well, what context am I seeing? Are they off season? Are they preseason? Are they postseason? Are they in season? And I think what that allows you to do is see it differently from far behind and saying, I understand it more. Here's a timeline. Can we do this? Let's work together. And that's a relationship I hope that you can set forth with all your patients and athletes. So if this is like, you're like, Chris, I love this stuff. I want to be part of it. And you're interested in learning how to do this, either whiteboard sessions or map this out for people. One of the things that I did and I will continue to do is build out programs for people given these challenges. And so what I did for my calf and what I've done for athletes, what I've done for other physical therapists to mentor, to allow them to give them a better opportunity to manage these people in these timelines. One program I just created and will be launched January 11th, 2023, whenever you listen to this, is my Sports PT Kickstarter program. So this is for individuals all over the world, the US, all over the world. If you want to spend 2 hours with me, live, interactive, online modules, I'm going to be going through 8 consolidated 8 weeks of sports physical therapy education only. If you ask me, what is it? It's kind of like, I've done a sports residency and I've worked in the pros and I work with pro athletes now. It's putting all that together into 8 weeks on how to manage people throughout all 4 seasons, whether that's acute, chronic, subacute, and design strength programs behind that. Basically learning how to manage athletes and get your foot in the door or fast track your career within sports physical therapy, and like all the pieces that you've been missing, whether it's a residency or an SCS or a CSCS, and you're like, what do I do? How do I do this? What is it that I need, that I'm missing? I've done the CSCS or I've done these courses. I don't know how to put it together. That's what this Sports PT Kickstarter is, ultimately changing the trajectory of your career path within sports PT. You're like, I'm in it, I want to accelerate it, or I don't know where to start, here's where to go, or I'm in it, how do I fine tune it? So that'll be happening January 11th, 2023. If you're interested, stay tuned, join my newsletter. It'll be on the website probably the next week for you to register, and it's going to be online, 8 weeks, 2 hours with me every single week. January through March, and I am excited to be able to help you guys through whiteboard sessions and all these things to be able to accelerate your career path. So I'm excited to see you there whenever that is. But beyond that, life is great, and my calf is beat up. If you're asking me, it is still sore, but ultimately, we'll be all right. We'll be all right. So I'll keep you guys posted. All right, on to the next episode, and I will see you guys then. I hope life is amazing. I'll see you soon.